Today we'll talk about good evening all. Today we'll talk about the specimen adequacy in a PAPssmear versus liquid based cytology. Okay, you can see when you are sending a PAPssmear from the OPD or any liquid based cytology from OPD, you can see there is so many times there are written in the reports that is it is unsatisfactory. Okay, so what is the minimum squamous cellularity requirement for a specimen to qualify as satisfactory in a PAPssmear specimen and in a liquid based cytology? I will discuss today. Okay, this is a neat questions or revisionist question. The minimal. We'll talk about the specimen adequacy in a PAPssmear specimen versus liquid based cytology, that is liquid based cytology. What is the minimum number of cell has to be there in that so that it is called as a specimen is adequate. Okay, for PAPssmear there should be 8,000 to 12,000 well visualized squamous cells for PAPssmears should be there. For liquid based cytology, remember it should be 5,000. Okay, 5,000. Okay, for liquid based cytology, the squamous cell should be visualized is 5,000 well visualized squamous cell. So remember, if you tell so if it is not this much cell, if the pathology will not get in that in your specimen, then you should disqualify it as. If it is less than that, then it is unsatisfactory. Okay, so remember, for PAPssmear to give, if you give a sample to be satisfactory, there should be 8,000 to 12,000, 8,000 to 12,000, 800 to 12,000 well visualized squamous cell has to be there. For liquid based cytology, if specimen has to give satisfactory result, then 5,000 squamous cell has to be there. If it less than that, then it is called as unsatisfactory. Okay. Another reason to tell it is unsatisfactory if it is partially obscure or completely obscure, like because of infections, debris, inflammations, the squamous cell become obscure. Okay, because of infections, debris, inflammations. Okay, in that case, how will tell specific adequacy? It is partially obscure means partially obscured, that is when 50 to 70%, 75%, 50 to 75% epithelial cannot, 50 to 75 cells, epithelial cells cannot be visualized. If 50 to 75 is not visual, that is called partially obscure. And when you tell unsatisfactory, if more than 75 patients epithelial cells obscured. Okay, this is another method to tell it is a inadequate specimen or adequate specimen, that is inadequate specimen or adequate specimen. Okay, another method is partially obscure. If it is 50 to 70% epithelial cell cannot be visualized, then it is partially obscure. Unsatisfactory when you tell if it is more than 75% of epithelial cell cannot be visualized, that is obscure, that is. Okay, if you get unsatisfactory results, what will you do next? What on suppose you will get unsatisfactory results. What will next? What will next plan? What will you do now? Because you know unsatisfactory is due to any infection, inflammation, any debris, any blood component, any vaginal discharge. So what will you do? The next step will be repeat cytology, repeat the test, repeat cytology in 2 to 4 months, okay, or maybe you can give a treatment for infections course or inflammations, any inflammations suspected. Second you can do, okay, what we'll do the second is you can do a, if you get two unsatisfactory results, okay, if you get two unsatisfactory cytology tests, PAPssmear test, cytology test results, then what we'll do next, if you get two, then the next step will be colposcopy test, okay, remember, very important. Here you also you can go for HPV HR HPV DNA testing, that is that high risk HPV virus, high risk HPV DNA testing, that is HPV 16 and 18. You can go for these two tests. Remember another things is the liquid based cytology and the cervical cytology is neither more sensitive nor more specific for detection of high grade cervical intraepithelial neoplasia compared with the conventional PAP test, okay. Okay, if you see the sensitivity and specificity versus PAPssmear and conventional PAPssmear versus LBC, that is liquid base cytology, there is no difference for detections of the high grade HSIL lesions in both PAPssmear and the liquid based cytology. There is no difference, very important, there is no difference. Remember, this is the MCQ, there will be no difference between these two in detections of high grade cervical intraepithelial neoplasia, okay, very important statement. So what are the things, if you are going for a PAPssmear or if you are going for a liquid based cytology, the sensitivity and the specificity is neither or nor more specific, those have a equal sensitivity and specificity in the detection of high grade cervical intraepithelial neoplasia, both PAPssmear as liquid based cytology. But remember, the LBC has an extra edge. What is that extra edge? Here you can get a specimen adequacy will be better, you can get a better specimen without no obscure cells, and the glandular component can be better identified. And another advantage is, with the sediment in the liquid bed cytology, you can do HR HPV DNA testing in the same sample. This is the advantage of liquid based cytology. But overall, if you are going for the sensitivity and specificity for the detection of high grade cervical intraepithelial neoplasia, both have equal sensitivity and specificity, very important statement, okay. Remember, overall I will tell the recap of this lectures. The specimen adequacy, if you go for a specimen, the PAPssmear and the liquid based cytology, the PAPssmear and the liquid based cytology have a, if you go for adequacy, 8,000 to 12,000 per PAPssmear, liquid based cytology is 5,000. If less than that, you call unsatisfactory. If it is, then what will do? And another things they'll do, if obscure cells you will get, if 50 to 75%, that is partially obscure. If it is more than 75%, then there is completely obscure, that is unsatisfactory. What will do in the next, if it is unsatisfactory, what is the next step? You will go repeat cytology test after 2 to 4 months, okay. Repeat cytology test will be done at 2 to 4 months, or maybe treatment you will give for infections and inflammations. If you get the two unsatisfactory result, then you go for directly colposcopy, or you can go for a HR HPV DNA testing, high risk HPV 16 18. The sensitivity specificity, if you compare PAPssmear versus liquid based cytology, there is no difference in between the two in the detections of cervical intraepithelial lesions, both have equal sensitivity and specificity. But the advantage of liquid based cycle is specimen adequacy will be better, glandular component can be easily identified, better identified, and sediment can be used for HR HPV testing in the sample. Thank you. Please subscribe my channels.